Healthcare access in the United States right now is challenged. Those premiums will double, and most families simply will not be able to afford the healthcare system. It's even more imperative everyone in the community has the access to be able to flourish. It disproportionately impacts those amongst us who are underserved. People have to make really challenging decisions.
Me and Adrian have been together since high school. I guess you could say high school sweethearts. And we have 2 beautiful children at home, and there's one more on the way. I found out that he was no longer going to be working. Getting healthcare, it is a struggle. Right now, it's very difficult with money. Having that gap in insurance, this is maybe the lowest that we have been.
When my husband was sick, I just felt lost in the world. He died. It's really hard, and everything you do nowadays takes money. Like, where am I gonna go when I need to stay healthy?
She has a heart problem. She's not gonna walk. She's not gonna talk. The doctor said that she was only gonna live for a year. And that scared me. It scared me so much because the insurance and how hard it was gonna be.
We are grandparents raising 4 grandkids, especially with their health issues, being hyper and autism and severe depression, severe anxiety. We needed the help for them.
With rising costs and premiums, it impacts people differently, and people choosing to not seek care. And so what you do is you create a scenario where you have the haves and the have-not.
Getting healthcare, it's still an additional cost, which is so horrible to say. Let me put my health aside because other things need to be met. Just making sure that we have food on the table and not having health care right now. It's a little scary. Greatest fear right now is not being able to pay rent and not knowing where to take my kids.
I felt like when he left, I wouldn't be able to do all the stuff that I'm doing. I don't want a walker, I don't want a cane, and I don't want a wheelchair. So I was worried about all of that because you don't know what you're gonna do.
I felt so sad. I felt so even mad at myself that maybe I did something wrong. Or if we could have prevented her to be sick. I knew Tia was gonna need help to thrive. Help for everything, not just only walking, eating, in the long run, in the long time.
I was concerned for their school grades. They were very behind on every material at school. Reading and math, everything. They had really low scores. We brought them in to TrueCare. They were really helping us out with so many resources. So first time we met Dr. Posadas, it was awesome. It was amazing because right away he was concerned for us and how to take care of the children.
Hi, how are you doing today? Good.
Sonia's kids have been my patients for a long time. Mission for me is for these kids to have success.
How are your grades like? Are you getting at least a C?
No, I'm getting at least 2 B's and all A's.
No matter what social status they have came from, they should be given the opportunity to succeed at least.
I like TrueCare a lot because Dr. Posadas, in my opinion, is a great doctor.
Every single staff member here and the providers, they're amazing doctors.
We are very fortunate here at TrueCare to have a team who are all focused on the mission of improving the health and the spirit and the social aspects of the communities we serve. It's really about connecting those patients and their families with those resources that will stick with those patients their entire lives. I mean, what an incredible impact.
I'm grateful that I have a community, I have a place like TrueCare that give us the help. It is beautiful. I feel like I'm happy what I have now. And she has grown so much. She's thriving. And that makes me so hopeful that she will have a good life. I have really big dreams for my children to give back to the community because we're receiving so much. I'm grateful I have a place like TrueCare.
Because without your health, you can't really enjoy your life. When I go to TrueCare, I get a lot of compassion. I feel the love of the people, and I feel like they want to take care of me. They want to make sure that I don't die early. Like if I'm 82, it can't be early now, but I want to live to 100. But I'm still not in no hurry to die. Not in no hurry.
We have been with TrueCare because they are there to help us. So I'm very grateful for the staff and the doctors, the nurses. Everyone is just very kind and helpful.
Even though it gets difficult, we can go into this dark holes, these dark moments. It was 4 to 5 months without a job. TrueCare has been nothing but family.
I want my kids just to be happy. That's it. Being bright and alive every day.
One bright, beautiful. You carry